Hi, my dear friends. Uh, I'm Dr. Subrata Malik. I have, I'm a doctor who served Sports Authority of India for last 29 years. And also I was the doctor of uh, previously that was in served in Coal India in Dhanbad as a general duty medical officer and the sports medical officer for Coal India, and also work for uh, uh, Ordnance Factory Board Hospital at Kashipur, Kolkata. So it's a pleasure. I feel I am taking this privilege to come in front of you to uh, have some chat, which I think I should be highly enjoying. So this particular chat, what I uh, am taking in concern, that is particularly regarding the health and fitness aspects related to particularly gym goers who are who are doing gym exercises, the resistance exercises, that is a strenuous exercise, load taking in some gyms anywhere in India and anywhere. So the thing is that uh, we should take precautions for anybody, the gym goers I'm telling, that certain parameters had to be looked after before anybody goes for a gym training exercises with enough load and all. My particular factors, I'm just going to detail that only. The factors and the particular factors which are some causative factors which can produce a detrimental effect on the health of an individual. So this is very important because in the past we have come across certain gym goers who had left us, and some of them are also celebrities, and some also I found in my long service as Sports Authority of India. Also I visited certain gyms and all, and I have come across certain sports people also who had suffered some sort of accidental attacks, some emergency cases, which are not good for the health, and some got injuries only, accidental injuries, and some ended, some injuries ended in a very fatal condition, and even they expired also, certain people. That is there. Uh, just like some celebrities, like I know about a comedian, actor who had also passed, and he was very popular in India. I don't want to name anybody or like that. Let us not talk about those things. But the main thing which I want to relate, that is, people should be cautious who are going for the gym, and they should go through certain factors which they should be aware of, and in that way it's a for the general people only I'm talking like that, because general people, they are not well updated with the particular this pros and cons of uh, attending gym exercises and all. But they should do that. So the factors which I want to say, those are like which are very important factors. Like person, first of all, he should uh, prepare himself to get eligibility or satisfy the eligibility criteria to attend a gym, weight training exercises and all. I am talking about those things. Not I am talking about the freehand exercises or the aerobic exercises only. I'm talking about the exercises like the resistance exercises with heavy loads and all. Suddenly, a person who is not adapted to that type of situation of carrying out heavy load exercises or like that, his body is not tuned up to do those exercises. So you need, all gym goers, you need to tune yourself up to go or attending or start a gym exercise session. This is number one. So the important factors which I want to discuss are, particularly there should be proper muscle tone of your body, and muscle tone you have to develop with your aerobic strenuous exercises and all. There are plenty of and also if the muscle tightness is not there, if a minimum standardized muscles tightness is not there, and you are going for a gym, you can get a muscle injury. Other than the muscles are attached with the bones, and one had to see whether the particular gym goer is suffering from any osteoporotic problems of the bone. If the bone is weak, and if the muscle contracts, and with the strenuous resistance exercises, the muscles attached with the bone is also going to get a stress, and there can be a particular type of stress fracture also. We call it a stress fracture, and also it can be called a pathological fracture also. That is a very important thing one should look after. Second thing is that with the muscles, the joint flexibility, that is also very important, particularly when you are lifting a weight and all. One should not go in a challenging attitude of going through flexible joint flexibility with a particular heavy load training. And if the flexibility of that particular person genetically or hereditary that is not appropriate, up to a certain standard, he can get a joint injury also, along with the muscle injury and the bone injuries. And there can be problem with the ligament injuries also. Ligament injuries, particularly ligaments, that is the connective tissues of a joint, we used to say. And the ligaments are fiber type of structure, but there is a elasticity, but the elasticity is not much. It is a little bit restricted, not much elasticity. And the quality of the ligament you are having, if that particular ligament is not having a proper this structural quality, and in that case the ligament may get a snap, and that will be a injury. And so one had to take care of this particular ligamental quality. And another thing about the ligament is that, suppose somebody has got previously he has got a ACL tear of the knee joints, that is a anterior cruciate ligament, or a PCL, posterior cruciate ligament, whatever may be. The lateral collateral ligaments are also there. Often, suppose, as an example I am talking, That is about the particularly knee joint I have taken up, but it can happen to other joints also, but for the knee joint as an example I am talking. So if he is doing some quadriceps strengthening exercises or some type of exercises with a heavy load, which is not supposed to be done by that particular individual, as the muscle tightness or the muscle tone or the muscle capacity, muscle load taking capacity is not proper with that particular weight, then the ligament also can get a injury, and ligamentous sprain can occur, ligamentous this particular thing. And for the muscles, the muscle pull also can result from as a muscle injuries. And next is the negative effects which gym goer. I have gone with plenty of gym goers, interviewed them, and I found they have got certain attitudes. Attitudes are very important when you are enter the gym for doing exercises. The attitudes are, some are having some aggressive type of attitude, that is with an aggression they have got in their psychological part, they feel that they can take up any sort of load, unmeasured, to carry on with their resistance exercises, resistance exercises like the exercises which are isokinetic type, or any sort of dynamic exercises with load inside the gym with any gym equipments there. And so that is a very important thing, that how much load one can take, that had to be assessed properly. And the gym trainers are there in the gym, but they guide, but sometimes I have found there not that proper gym trainers are there in certain gyms, and in that case some injuries have occurred also, because the gym trainer, he doesn't have that aptitude to give the proper training weight load for carrying on the exercise by gym goer who has come. Next is the challenging attitude. Suppose somebody who is in the gym and has got enough strength, some particular person, and he's taking heavy load for his biceps, triceps, or quadriceps, lower limb quadriceps, hamstring muscles, he can take the load. But new fresher who is there, he also feels like that I can take that load what the other individual is taking, and he goes in a competitive mode or a challenging mode, and this challenging mode he is taking those particular loads and all, and he gets injury either of the muscles or ligaments, or even cartilage problems also occur, but that is rare, particularly the muscles and the ligaments and the tendinous injuries, the muscle tendons, that is a big problem. Other than that, there are particular individuals who want a short-term effect after going for the gym, and for going to the gym to get a short-term effect means within a very short period they want to develop their muscles, they want to develop their tightness and tonicity of the muscles and some bulges and all. It is not possible by a shortcut way or short-term period doing exercise in the gym. In the gym, the loads one had to take, it had to be gradually increased. It is not like that suddenly one day you are taking a particular weight, particularly for the quadriceps exercise or like that. Second day you take a more weight or like that, but there should be a particular measure. In that way, there should be a regime, like in what way you are increasing the load, day by day activities. That is a very, very important thing. If one tries to do it suddenly, taking a heavy load, it can harm that particular person, regarding suppose quadriceps injury, hamstring injury. I have seen those people. They are not very understandable. They want, they certainly argue also sometimes that, "Oh, okay, I can do that, I can." It's good that you have got I mean, a complexity that I can do this and that. That challenging attitude, aggression, everything is required in life. But the thing is that uh, it should be there should be a sense of proportion of your thinking process. If the sense of proportion goes out from your thoughtful processes and you are trying to challenge somebody who is more stronger than you, and you are trying to challenge that particular person, that what is the load he is taking and you can take also, it is not possible always. Don't go for a challenge, that is also an inviting injury. So I'm discussing only that is very important, these particular things. And next is that taking some oral anabolic steroidal any drug, or some injectable strength training, these things, the steroids and all. This can cause big problem, because steroids certainly increases, gets the muscles hypertrophied. It becomes strong. The muscles gets swollen with more protein congestion. But the problem is that the muscles, okay, against the strength also, but if but the tendon, the muscle ends in a tendon, that is a fibrous rope-like structure that is linked with the the other bone, like it gives a lever system of activity when a muscle moves like that. Like I think you people know it like that, like patellar tendon. It is just a we have got a patellar bone, and the quadriceps muscles, or this muscle bulk ends up in a particular place, and after that from the patella to tibia, that is the lower leg bone, the tendon is attached. So tendon, when the muscle contracts, the tendon is pulled and the lever system works, and you can take your limb up, like the patellar tendon of the quadriceps. When it gets pulled, you can get your leg, your lower limb, from the a knee flexion to a knee extension movement. So that is the lever system of the joint system. God has created like that. It's like that. So the tendons are not getting any strength. Tendon fibers are not hypertrophied. The tendons cannot take that load. So there can be a snap of the at the joint place, where the muscle ends and the tendon is linked with the muscle, attached with the muscle. That particular zone, there can be a snap. And even the quadriceps, if it cannot take much load, then your quadriceps muscles can also get a snap at a maximum pressure point. So these are very important things which you should know in the gym injuries. Next is that taking certain nutritional supplement. Okay, nutritional supplement, powders and all, you are taking in a concentrated form. But whenever a protein or any sort of, it can be whey protein or whatever it may be, that is formed by the artificially from the main protein, that protein is turned into powder, and this powdered protein is made in a pack. And this when the pack is formed or like that, sometimes there may be certain problems like that, something anabolic steroids also. You have to see that in the level whether there is any anabolic steroids being also uh, introduced, or it also is an ingredient of that particular nutritional supplement protein powder mass, whether it is being mixed up. If it is mixed up, that particular steroid and all, it causes this problem, the steroidal part what I was discussing. And it can, this particular steroid has got another particular thing that sometimes these steroids, this not sometimes, this is absolutely, it is there, that the steroids also help in water accumulation inside the muscles. Usually the muscles, one come across that the muscles are getting swelled up, and he thinks that he is getting strong, his muscles are hypertrophied, but along with that water content of the muscles is also there, so the muscles look like very much swelling type of muscles. So the and your body weight also increases. It is not decrease, the body weight increases because there are more water accumulation inside the muscles, which should not be in the natural way. It should not be, but it is there. So these nutritional supplements is better to take into concern. And another thing is that the nutritional supplements, this can this has got certain batch system, the particular batch system where the expiry date and all these things, that can be also sometimes not true or not proper, because the supplements which are not used up by some commercial companies or like that, I'm not talking about all companies, good companies that are there, and there are peculiar companies which also sell all these nutrition supplements under the demands at a lower price or like that. But this particular thing, this batch numbers along with the year of manufacturing and ending up, expiring, that is not properly done, because the old batch package, again when it is not sold, again a new number, batch number with sticker, everything together being pasted, and you have to find out that whether it is a fresh one or an old one, which is not being used up and expiring, and that is being used up commercially for the profit of the business of the nutritional supplement. That is also a problem. Sometimes it's a problem. Now FIFA, I have done a course, and FIFA has made it like that's clear. The FIFA, I think you know this International Football Association, that is the this. So they have banned. They have already told all footballers of all countries not to take nutritional supplements like that, because they don't approve, particularly because some of the players are being caught of having certain drugs which should not be there, but after analysis or after assessing what is the problem, so it has been found that they have contacted with those drugs which were in that particular nutritional supplement bag, and they are being caught for doping, and doping is a big problem. They have suffered and they cannot, they are, so this is one very important. Other than that, there may be, which is very very serious, there may be internal undiagnosed diseases. That is the internal system, the physiological system, the physiological functional system. If it is disturbed, if it is having some particular prevalent diseases from beginning, maybe acquired by the hereditary factors, genetic factors, or they have come across some problems of the heart, lungs, or any type of diseases like that. Somebody may have the COPD, chronic obstructive pulmonary disease or disorder. So these particular things have to be found out, and for that doctors are required to find out the problems of a gym goer before he enters a gym, because the gym goer may not be having that part of consciousness, the common gym goers who are non-professionals, who are not non-doctors. Next is that and these particular problems which I have just told, these are untraceable until it's being checked out. By. Next is the hormonal diseases, like there is some problems with the thyroid problems, some undetected thyroids, undetected pituitary gland hormonal problems, which is the master gland, which is controlling the other hormonal glands and all. So that can be having problems, and all those things had to be taken very care, the hormonal diseases. Next is that the cardiovascular diseases may be what I have discussed only, the congenital part, that is the genetically sorry, genetically person is having from birth level, but it was undetected. That also cause serious problem, and there can be an accidental attack, heart attack, while doing exercise or while coming out after a strenuous exercise, and all those things have to be found out. It is a very serious problem, and congenital and already shown that particular gym goer has, he knows that he has got a cardiac problem or a lung problem or any other circulatory problems or some problems of other organs also, but still he or she just kept it hidden, or just not expressed when he is joining a gym or doing a regular exercise, going through regular exercise. Those are very important things. Next is one should think about the problem of the underweight, overweight, or obese individuals. They should not go for very strenuous exercises, resistance exercises in the gym without the opinion of a sports doctor or an exercise level doctor, and that had to be done. This is what I found as a sports medicine specialist. Specialization I have done, a post-graduation diploma in sports medicine I have done long back. At that time, India has just taken up this particular subject into concert. So it was at the time of 1988, 89. At that time, there's a long back. and I have done my medicine, that is in 1990. So at that time, uh, we used to uh, uh, get taught uh, by our sirs, respected sir, uh, who used to take our classes in the sports medicine part, and they had told that one has to find out the fitness aspect for doing an exercise. If the person is not fit, he cannot do exercise. Even I found in the just to share only, I found a football coach. He is giving a particular strategic, I mean, game planning before those players of his team is going for a final match or like that. But if that particular boy, if it's a boy team or a girls team, whatever it may be, he's not up to the not in the limit of having good fitness and good health, and his cannot work out in the same way as his or her coach is telling, because the coach is always at that time right, but the player health and fitness is not uh, helping the player to go according to the guidance of the planned guidance of the coach, because they are the players fitness is also very important. If he is not fit, he cannot take a proper strategic plan what his or her coach had laid out. It is absolutely very important thing. Next is that uh, before, I mean, getting admitted in a gym, one should go for the biochemical testing, the biochemical analysis. That is the testing of the particular biochemical, like uric acid, uh, uh, then routine blood examination, uh, and all those things. Uric acid, if creatinine content in his blood and all. These blood tests are very important, and other ingredients in the blood or like that in the body. Certain ingredients are high. Uh, then he had to take some proper treatment. He had to get it leveled up in the normal ingredient level what he or she should have in a body. But without getting leveled up with some good treatment from a doctor or like that, without any analysis, that is also not fair for one to go for a exercise, all these things, gym exercises and all, which is a very strenuous exercise. Next is the age factor and the sex factor. The age factor is very important. Particularly, one should not go for heavyweight gym exercises at a particular age. Throughout that particular age, there is an age limit, and after that only it's better to go for gym strengthening exercise. Other than that, if a boy is there and his age is 14, 15 years or like that, I'm not telling that he should not go for any weight training exercise. He can go for a weight training exercise, but any exercise that that is being done by I mean by just using his own body weight, that body weight he is trying to do certain exercise, that is good. And also the aerobic part is very important to be done at that time. After 16 years like that, and after 16 years, 17 years, 18 years or like that, whatever it may be, 16, 17 years or like that. Then he can go for certain weight training exercise. And that weight training exercises which he will do in the gym with the gym equipments and all gym apparatus, he should uh, get it gradually increase the training load, the weight load. It is the number of repetitions and number of holding ups with that weight, and all these things had to be done. Other than the gym session, there is a candidate is involved with regular physical strenuous uh, activities, sports, causing overstress. Certain activities, one footballer or hockey player or any particular person, he may have gone through, and that training is an overtraining load already he has got in the field activity, and again he is going for the gym, and that also causes a big problem, because in the gym his muscles are already tired, fatigued, and with that type of situation he should not do gym exercises to avoid injuries. Otherwise the injuries can come up. It's a very important thing. So I have found also those type of players also. And next is that the psychological part is very important. Like suppose you are under stress, and your body has got a particular stress hormone increased. You know the stress hormone, that is the cortisol hormone I am talking about. That cortisol hormone increases when your mind is on stress, and your happy hormones which are being reduced, like the dopamine, serotonin, and other hormones, those which are oxytocin and all those, these hormones are reduced at that time when you are in tensions, anxiety, or like that. So these hormones are called the happy hormones. The happy hormones are not there because you are under stress, and the cortisol has increased, and the cortisol increased your BP, blood pressure, your heart rates, and other things, vice versa. All these things, you are suffering from the circulatory problems, some speedy circulation which is not to be, and in that particular stress condition, you should not attend the gym. That is my advice. It's better not to, because under that stress condition, a normal person can also get a heart attack or some deadly attacks of any certain organs or like that, some respiratory, cardiorespiratory problems and all those things. Next is the arterial oxygen that had to be found out, and the heart rate level when he is attending the gym. Then is the respiratory diseases that had to be seen, that whether that particular person is suffering from a chronic obstructive pulmonary disease or other things. Those are very important. Already I have told. Then there is a case of this diet is also a very important thing. You are taking less protein diet, less carbohydrate, and less fat, and suppose the balancing of your diet, that is the balanced diet, you are also not taking, but you are doing exercise. You are going to get, your muscles are going to, your body is going to get a burned out effect, and that burned out effect will cause a physiological disturbance in his body or like that, and sometimes that particular person can get affected if he is not getting restricted with his exercise at that time also, and going on doing on like that. He can end up in certain type of problems, like blood sugar increase in his blood or like that, and that diabetic part also can come up. Diabetes can result, and due to that, because the cell absorption of sugar from the blood gets decreased, and the sugar stays in the blood for a longer period. And when a sugar stays in your blood, sugar means glucose, I'm talking about blood, the glucose, that glucose, if it stays for that carbohydrate stays for a long time, it will turn to fat. That particular person can become plumpy or like that. That is the first part, uh, signs and symptoms I'm talking about. But let's hope nobody goes up to that level to have a diabetes after coming out of the gym. So, but still, it is rare, but it can happen. It can happen if you don't take proper care of your body. That's a big problem. Next is that uh, drug addictions. Suppose one had to find out whether you are addicted to any drug. Even somebody is smoking a lot, is taking cigarettes and smoking a lot, and goes for the gym also at the same time. I think he should not do that thing, because his drug problems that can give cause a serious problem for internal problems like that when he is going to do gym with that addiction, drug addiction. Next is that taking alcohol, and after taking alcohol to go to the gym, that is very bad. It should not be done. That is I will say that's a crime. But even taking of alcohol, I mean, not in a measured amount, and is better not to take alcohol. I cannot say as a doctor that alcohol is very good, because it contains 0 calories. It is that particular calorie is not made up what your body works or like that, demands or like that. But if you taking like that some unmeasured quantities of alcohol or like that, again you are doing gym. I think that gym activities, or the demand what you have got, psychological demand of your making your body very fit and all, and that is not going to help. It is absolutely, it will be fruitless for attending gym. Next is that one had to ask, when a particular gym goer is attending a gym or like that, or starting up a gym starter, exercise starter, so he should disclose all the facts, that whether he is suffering from any sort of chronic diseases like hypertension, that is high blood pressure, diabetes, asthma, or any hormonal problems. That is also very important. Hormonal problems should not be there. So those things have to be found out, and whether he is under medication or part or like that. I'm not telling that somebody who is under medication for certain, suppose a diabetic person or a person having some other disease also, what I'm telling currently. If he is under treatment, and if the medicines what is being given for his particular sort of chronic disease, and it is in that the disease is well controlled with the medicinal factors and all, then I think he can be allowed for doing gym exercises. It's nothing like that to be afraid of, that he cannot do any gym, because gym is exercises are very important in some way, because to maintain a good tonicity of the muscles, because to avoid muscle degradation, degenerations, and other wasting and all, for the particularly the aged people also should go to the gym to do measured quantity of load training exercises, not much, but just to maintain the muscle strength, quality, and all. So today I think I've talked a lot, and I think if you like my in detailing, my explaining about this awareness part, that is the health and fitness part, related with the gym activities, or if you want to make any queries or questions to me, you can obviously do so. Uh, for my informations, I'm telling my credentials. That is my telephone number, my mobile number. I'm telling. Please, if you can note it down. That is 9830261443. This is my mobile number, and my this email number is email ID, I will say, that is all in small letters, that is dr dot s dot MALLICK@gmail.com. So today I feel uh, this is enough, but I'm going to continue my lectures in other sessions, and already have taken a slot in the YouTube. So if you like, you or you want to share and your I mean impressions and all everything, you can share with me and share. So that is all. So thank you, and I'm ending my lecture. It's a pleasure to talk to you all. Yes, thank you very much.